Hi everyone, welcome back to my YouTube channel. On August 1st, 2023, CMS issued a final rule for fiscal year 2024 hospital inpatient prospective payment system and long-term care hospital prospective payment system. Today's video is about the portion of that final rule that pertains to the hospital quality reporting program. Let's get started. Hospital Inpatient Quality Reporting or IQR program. The Hospital Inpatient Quality Reporting Program is a pay-for-reporting quality program that reduces payment to hospitals that fail to meet program requirements. Hospitals that fail to submit quality data or to meet all hospital inpatient quality reporting program requirements are subject to a 1/4 reduction in their annual payment update under the Inpatient Prospective Payment System. In the fiscal year 2024 Inpatient Prospective Payment System / Long-Term Care Hospital Prospective Payment System Final Rule, CMS is finalizing the adoption of 3 new measures, the removal of 3 existing measures, and the modification of 3 current measures. CMS is also finalizing 2 changes to current policies related to data submission, reporting, and validation. Specifically, CMS is adding 3 new electronic clinical quality measures or ECQMs to the inventory of ECQMs from which hospitals can select to meet the ECQM reporting requirements for a given year for both the hospital inpatient quality reporting and Medicare promoting interoperability programs. The 3 new electronic clinical quality measures or ECQMs are: first, hospital harm pressure injury ECQM with inclusion in the ECQM measure set beginning with the calendar year 2025 reporting period / fiscal year 2027 payment determination. Second, hospital harm acute kidney injury ECQM with inclusion in the ECQM measure set beginning with the calendar year 2025 reporting period / fiscal year 2027 payment determination. Third, excessive radiation dose or inadequate image quality for diagnostic computed tomography or CT in adults, hospital level inpatient, ECQM with inclusion in the ECQM measure set beginning with the calendar year 2025 reporting period / fiscal year 2027 payment determination. CMS believes the adoption of the hospital harm acute kidney injury and hospital harm pressure injury ECQMs will support CMS's goal of advancing health equity. Acute kidney injury is more common in Black hospitalized patients than non-Black patients. Research has shown a higher prevalence of pressure injuries in patients with darker skin tones and that patients with darker skin tones are at higher risk of developing higher stage pressure injuries. This research suggests that current skin assessment protocols could be less effective at assessing lower stage pressure injuries for people with darker skin tones. By adding these measures to the hospital inpatient quality reporting program, hospitals will be better able to implement appropriate quality improvement to reduce them. CMS is finalizing modifications to 3 current measures: hybrid hospital-wide all-cause risk standardized mortality measure beginning with the fiscal year 2027 payment determination. CMS is finalizing a modification to include Medicare Advantage admissions. Second, hybrid hospital-wide all-cause readmission measure beginning with the fiscal year 2027 payment determination. CMS is finalizing a modification to include Medicare Advantage admissions. Third, COVID-19 vaccination coverage among healthcare personnel or HCP measure beginning with the fiscal year 2025 payment determination. The prior version of this measure reported on the primary vaccination series only, while the updated version of the measure reports the cumulative number of healthcare personnel who are up to date with recommended COVID-19 vaccinations to align CMS programs with the Centers for Disease Control and Prevention's or CDC's definition of up-to-date vaccination, keeping the measure relevant if future vaccination guidance evolves. CDC vaccination guidance can be found at the link that you can see on this slide. This link is also available in the description box down below. This measure modification is a cross-program change for the hospital inpatient quality reporting program, PPS exempt cancer hospital quality reporting program, and the long-term care hospital quality reporting program. CMS is finalizing removal of three measures: hospital level risk standardized complication rate following elective primary total hip arthroplasty and/or total knee arthroplasty measure beginning with the April 1, 2025 through March 31, 2028 reporting period / fiscal year 2030 payment determination. CMS is finalizing removal of this measure under the Hospital Inpatient Quality Reporting Program in conjunction with the adoption of the recent updates to this measure in the Hospital Value-Based Purchasing Program. Medicare spending per beneficiary or MSPB hospital measure beginning with the calendar year 2026 reporting period / fiscal year 2028 payment determination. CMS is finalizing removal of this measure under the Hospital Inpatient Quality Reporting Program in conjunction with the adoption of the recent updates to this measure in the Hospital Value-Based Purchasing Program. Third measure, elective delivery prior to 39 completed weeks gestation. Percentage of babies electively delivered prior to 39 completed weeks gestation measure beginning with the calendar year 2024 reporting period / fiscal year 2026 payment determination. CMS is finalizing the removal of this measure because measure performance is so high and unvarying that meaningful distinctions and improvements in performance can no longer be made, that is topped out. The measure has been topped out for the last 6 performance periods. CMS believes the several measures focused on maternal health as finalized in the fiscal year 2022 and 2023 Inpatient Prospective Payment System / Long-Term Care Hospital Prospective Payment System Final Rules, including the maternal morbidity structural measure, the cesarean birth ECQM, the severe obstetrics complications ECQM, and finalize the creation of the birthing friendly hospital quality designation, will continue to monitor and drive care improvements. CMS is finalizing updates to the data submission and reporting requirements for the Hospital Consumer Assessment of Healthcare Providers and Systems or HCAP survey measure beginning with the calendar year 2025 reporting period / fiscal year 2027 payment determination. These updates include 3 new web-first modes of survey implementation, removal of the service prohibition on proxy respondents, extension of the data collection period from 42 to 49 days, limiting the number of supplemental survey items to 12, requiring the official Spanish translation for Spanish language preferring patients, and removing 2 administration methods that are not used by participating hospitals. Medicare Promoting Interoperability Program. In 2011, CMS established the Medicare and Medicaid Electronic Health Record Incentive Programs, now known as the Medicare Promoting Interoperability Program, to encourage eligible professionals, eligible hospitals, and critical access hospitals to adopt, implement, upgrade, and demonstrate meaningful use of Certified Electronic Health Record or EHR technology or CE, HRT or CERT. CMS is finalizing the following changes to the Medicare Promoting Interoperability Program for eligible hospitals and critical access hospitals. Modified requirements for the safety assurance factors for EHR or electronic health record resilience or safer guides measure to require eligible hospitals and critical access hospitals to attest yes to having conducted an annual self-assessment of all 9 SAFER guides at any point during the calendar year in which the electronic health record reporting period occurs, beginning with the EHR reporting period in calendar year 2024. Amend the definition of EHR reporting period for a payment adjustment year for participating eligible hospitals and critical access hospitals to define the EHR reporting period in calendar year 2025 as a minimum of any continuous 180-day period within calendar year 2025. Amend the definition of EHR reporting period for a payment adjustment year such that eligible hospitals that have not successfully demonstrated meaningful EHR use in a prior year will not be required to attest to meaningful use by October 1st of the year prior to the payment adjustment year, beginning with the EHR reporting period in calendar year 2025. Modify the response options related to unique patients or actions for objectives and measures for the Medicare Promoting Interoperability Program for which there is no numerator and denominator and for which unique patients or actions are not counted. The response option for these objectives and measures would read, not applicable, measure is yes/no. Adopt 3 new ECQMs eligible hospitals and critical access hospitals can select as one of their 3 self-selected ECQMs in alignment with the Hospital Inpatient Quality Reporting Program beginning with the calendar year 2025 reporting period. First, hospital harm pressure injury ECQM. Second, hospital harm acute kidney injury ECQM. Third, excessive radiation dose or inadequate image quality for diagnostic computed tomography or CT in adults, hospital level inpatient ECQM. PPS exempt Cancer Hospital Quality Reporting or PCHQR program. The PCHQR program is a quality reporting program for the 11 cancer hospitals that are statutorily exempt from the inpatient prospective payment system. CMS collects and publishes data from PPS exempt cancer hospitals or PCHs on applicable quality measures. In the fiscal year 2024, Inpatient Prospective Payment System / Long-Term Care Hospital Prospective Payment System Final Rule, CMS is finalizing the following. 1. Beginning public display of the surgical treatment complications for localized prostate cancer measure beginning with data from the fiscal year 2025 program year. CMS is finalizing adoption of 4 new measures for the PPS exempt Cancer Hospital Quality Reporting Program. First, facility commitment to health equity beginning with the fiscal year 2026 program year. 2. Screening for social drivers of health beginning with voluntary reporting for the fiscal year 2026 program year and mandatory reporting for the fiscal year 2027 program year. Third, screen positive rate for social drivers of health beginning with voluntary reporting for the fiscal year 2026 program year and mandatory reporting for the fiscal year 2027 program year. Documentation of goals of care discussions among cancer patients beginning with the fiscal year 2026 program year. CMS is also finalizing modification of the COVID-19 vaccination coverage among healthcare personnel measure in alignment with the Hospital Inpatient Quality Reporting Program and Long-Term Care Hospital Quality Reporting Program. CMS is finalizing modification of the data submission and reporting requirements for the HCAP survey measure beginning with the fiscal year 2027 program year. Hospital Readmissions Deduction Program. The Hospital Readmissions Deduction Program is a value-based purchasing program that reduces payments to hospitals with access readmissions. It also supports CMS's goal of improving health care for patients by linking payment to the quality of hospital care. CMS did not propose or finalize any changes to the hospital readmissions reduction program. Hospital Acquired Condition or HAC Reduction Program. The Hospital Acquired Condition Reduction Program creates an incentive for hospitals to reduce the incidence of hospital acquired conditions by reducing Medicare fee-for-service payment by 1% for applicable hospitals that rank in the worst performing quartile on the measures of hospital acquired conditions. In the fiscal year 2024, Inpatient Prospective Payment System / Long-Term Care Hospital Prospective Payment System Final Rule, CMS is finalizing the following proposals to establish a validation reconsideration process for hospitals that fail to meet data validation requirements beginning with the fiscal year 2025 program year affecting calendar year 2022 discharges. CMS is finalizing the proposal to modify the targeting criteria for data validation to include hospitals that received an extraordinary circumstances exception or ECE during the data periods validated beginning with the fiscal year 2027 program year affecting calendar year 2024 discharges. In addition, CMS provided a summary of the comments received on their request for feedback on potential future measures and program modifications that would advance patient safety and reduce health disparities. Hospital Value-Based Purchasing Program. The Hospital Value-Based Purchasing Program is a budget-neutral program funded by reducing participating hospitals' base operating DRG payments each fiscal year by 2% and redistributing the entire amount back to the hospitals as value-based incentive payments. In the fiscal year 2024 Inpatient Prospective Payment System / Long-Term Care Hospital Prospective Payment System Final Rule, CMS is finalizing the proposals to adopt the severe sepsis and septic shock management bundle measure in the safety domain beginning with the fiscal year 2026 program year. CMS is finalizing the proposal to adopt a health equity scoring change for rewarding excellent care in underserved populations such that a health equity adjustment would be added to hospitals' total performance scores based on both a hospital's performance on existing hospital value-based purchasing program measures and the proportion of individuals with dual eligibility status that a hospital treats. As a result, CMS is also finalizing the proposal to modify the TPS or total performance scores maximum to 110 such that the numeric score range would be 0 to 110. CMS is also finalizing the proposal to adopt substantive measure modifications to the Medicare spending per beneficiary hospital measure, allowing readmissions to trigger new episodes beginning with the fiscal year 2028 program year. CMS is finalizing the proposal to adopt substantive measure modifications to the hospital level risk standardized complication rate following elective primary total hip arthroplasty and/or total knee arthroplasty, adding additional mechanical complication ICD-10 codes to the measure beginning with the fiscal year 2030 program year. CMS is finalizing the proposal to adopt changes to the data submission and reporting requirements of the HCAHPS survey measure beginning with the fiscal year 2027 program year. CMS is finalizing the proposal to codify the measure removal factors, the health equity scoring, change and modification of the total performance score numeric score range, and the minimum number of cases. Long-Term Care Hospital Quality Reporting Program. The Long-Term Care Hospital Quality Reporting Program is a pay-for-reporting program. Long-term care hospitals that do not meet reporting requirements are subject to a 2 percentage point reduction in their annual increase factor. In the fiscal year 2024 Inpatient Prospective Payment System / Long-Term Care Hospital Prospective Payment System Final Rule, CMS is finalizing the following proposals. Beginning with the fiscal year 2026 Long-Term Care Hospital Quality Reporting Program, CMS finalized the adoption of the COVID-19 vaccine, percent of patients/residents who are up to date, patient/resident level COVID-19 vaccine measure. The measure reports the percentage of stays in which patients in a long-term care hospital are up to date with their COVID-19 vaccinations per the latest guidance of the CDC. Data would be collected using a new standardized item on the LCDS. The measure has the potential to increase COVID-19 vaccination coverage of patients in long-term care hospitals. Beginning with the fiscal year 2025 Long-Term Care Hospital Quality Reporting Program, CMS finalized the adoption of the Functional Discharge Measure. This assessment-based outcome measure assesses functional status by assessing the percentage of long-term care hospital patients who meet or exceed an expected discharge function score and uses mobility and self-care items already collected on the assessment tool. The adoption of this measure would replace the top-down process measure application of functional assessment and care plan. Beginning with the fiscal year 2025 Long-Term Care Hospital Quality Reporting Program, CMS finalized to update the COVID-19 vaccination coverage among healthcare personnel measure in alignment with the Hospital Inpatient Quality Reporting and PPS exempt cancer hospital quality reporting programs. Beginning with the fiscal year 2025 Long-Term Care Hospital Quality Reporting Program, CMS finalized the removal of the application of percent of long-term care hospital patients with an admission and discharge functional assessment and a care plan that addresses function application of functional assessment/care plan measure. CMS's regulations describe 8 factors they consider for measure removal from the long-term care hospital quality reporting program. CMS finalized this measure's removal for 2 reasons. First, the application of functional assessment/care plan meets the conditions for measure removal factor 1 top-down. Second, this measure meets measure removal factor 6 as there is an available measure that is more strongly associated with desired patient functional outcomes. Beginning with the fiscal year 2026 Long-Term Care Hospital Quality Reporting Program, CMS finalized to increase the Long-Term Care Hospital Quality Reporting Program data completion thresholds for the LCDS data items. CMS finalized that long-term care hospitals must report 100% of the required quality measured data and standardized patient assessment data collected using the LCDS on at least 85% of the assessments they submit through the CMS designated submission system. Any long-term care hospital that does not meet the finalized requirement that 85% of all LCDS assessments submitted contain 100% of required data items will be subject to a reduction of 2 percentage points to the applicable fiscal year APU beginning with fiscal year 2025. Beginning with the September 2024 Care Compare Refresh, or as soon as technically feasible, CMS finalized the public reporting of the transfer of health information to the provider, PAC or post-acute care measure, TOH provider, and the transfer of health information to the patient, PAC measure or TOH patient measures. The measures report the percentage of patient stays with a discharge assessment indicating that a current reconciled medication list was provided to the subsequent provider and/or to the patient/family/caregiver at discharge or transfer. This is it for today. Thank you for joining me. If you enjoyed this video, please consider subscribing to my channel. Hope to see you next time. Bye now.